Governor, thank you for the opportunity to provide this briefing on global health security and its implication for Texas. Global health security refers to the systems and partnership that allows governments and public health agencies to prevent, detect, and respond to health threats that can spread across borders. In an interconnected world, infectious diseases, disasters, and other public health emergencies can move rapidly through trade, travel, and population movement. This briefing will outline why global health security matters for Texas, identify key threats that could affect the state, and recommend actions that can strengthen preparedness and capacity. The goal is to support informed decision making that protects both public health and economic stability. To begin, I will briefly outline the objectives of this briefing. Governor, this briefing focuses on four key objectives. First, it will define global health security and explain why it's important for protecting public health system. Second, it will identify three major global health security issues that could affect Texas during the coming years. Third, it will highlight one priority issue that deserves early attention from state leadership. Finally, the briefing will present several recommendations that can strengthen Texas preparedness and response capacity. Together, these objectives provide a framework for understanding the risks Texas faces and the actions that can improve resilience. Before discussing specific threats, it's important to understand what global health security means. Health security refers to the collective efforts of countries, organizations, and health system to prevent, detect, and respond to public health threats that cross national borders. In today's globalized environment, infectious diseases can spread rapidly through international travel, trade networks, and population movement. As a result, the health security of one region is closely connected to the health security of others. Strong global health security depends on effective disease surveillance systems, laboratory capacity, trained public health officials, and coordinated emergency response. When these systems function effectively, governments can detect outbreaks early, limit transmission, and prevent local events from becoming large scale public emergency. These systems are particularly important for states with strong international connection like Texas. Governor, several factors make global health security particularly important for Texas. First, Texas has one of the largest populations in the United States, which increases the potential impact of infectious disease outbreaks. Next, Texas contains several major international travel hubs, including airports in Houston, Dallas Fort Worth, and Austin. These transportation networks connect Texas to global travel routes and increase the likelihood that emerging disease could enter the state quickly. Finally, Texas shares a long international border with Mexico where millions of people and goods cross each year. While this movement supports economic growth, it also requires strong coordination between public health systems to manage disease risk. Because of these factors, maintaining strong preparedness systems is essential for protecting Texas communities. With that context, three major global health security threats require particular attention. Texas faces three major global health security threats that require attention. The first is emerging infectious disease and pandemics. Events such as COVID-19 demonstrates how rapidly pathogens can spread through the international travel and population movement. The second threat is cross-border disease transmission. Because Texas shares an active international border, effective surveillance and cooperation between neighboring health systems are essential. The third threat involves natural disasters and climate related health emergencies. Texas frequently experiences hurricanes, flooding, extreme heat events that can disrupt healthcare system, increase health risk for vulnerable populations. These threats demonstrate why strong preparedness and coordination across public health and emergency management systems are critical. Among these threats are one issue stands out as requiring immediate attention. The most urgent global health security issue for Texas is pandemic and emerging infectious disease preparedness. Recent history demonstrate how disruptive pandemics can be. Outbreaks such as SARS, H1N1, influenza, and COVID 19 spread rapidly through international travel networks and placed enormous strains on the healthcare system around the world. Texas' large population, international travel hubs, and cross border movement increases the state's vulnerability to emerging infectious disease threats. Strengthening preparedness requires investment into these surveillance systems, laboratory capacity, public health workforce development, and coordinated emergency response planning. Even modest improvement in surveillance and preparedness systems can provide substantial population level benefits. When applied across Texas' population of nearly 30 million residents, small improvements in early detection and response coordination can significantly reduce disease transmission and protect communities. For these reasons, pandemic preparedness should remain a central priority for protecting both public health and economic stability in Texas. Several actions can significantly strengthen the state preparedness moving forward. Four actions can significantly strengthen Texas global health security. First, Texas should continue investing in public health infrastructure, including laboratory capacity, workforce development, emergency response systems. Second, improving disease surveillance and early detection system will allow health officials to identify outbreaks quickly and respond before they spread widely. Third, strengthening cross-border public health collaboration with neighboring region can improve surveillance coordination, emergency response planning. Finally, expanding emergency preparedness training and interagency response exercises will ensure that public health agencies, hospitals, and emergency department systems are prepared to respond effectively during crises. Together, these strategies can significantly improve Texas' ability to prevent, detect, and respond to future health threats. Before concluding, I will briefly review the key point. I'm sorry, I jumped forward. I'm sorry. Before concluding, I will briefly review the key points from this briefing. Briefing highlighted the importance of global health security for protecting Texas communities. We defined global health security and discussed its role in preventing. I defined global. Yes, we defined global health security and discussed its role in preventing, detecting, and responding to health threats that cross international borders. We examined why Texas faces unique vulnerabilities due to its large population, international travel connections, and long international border. We also identified three major threats facing the state: emerging infectious diseases, cross border disease transmission, and climate related health emergencies. Finally, we discussed the importance of prioritizing pandemic preparedness and strengthening Texas public health infrastructure, surveillance systems, and emergency response coordination. Thank you for the opportunity to provide this briefing. I would be happy to answer any questions. This slide lists the key sources used to support this briefing, including guidance and research from Centers for Disease Control and Prevention, the National Academic of Sciences, and the World Health Organizations. These organizations provide evidence-based research and policy guidance that inform public health emergency preparedness and response strategies. Thank you.